Welcome to The Conversation. My name is Shannon Taylor, and I'm the Executive Director of Blacks and Jews in Conversation, or not just Blacks and Jews in Conversation. And to that purpose, we have an extra special educational treat for our listeners today. Dr. Nelson Lee Novick, the Lee is in memory of his dear mother, but we give you the abbreviated version on the screen, is a dermatologist. And the dermatologist has many facets that one normally is not aware of. It covers all types of variations of the human physiognomy that I myself was not aware of. We have presented all kinds of medical specialties on this program through the last 2 years. We have not yet reached dermatology. By the time we conclude this first half hour, you'll wonder why we didn't present Dr. Novick first. He's come with brochures. He's an author of many books. He's appeared on Oprah. And he's going to explain as best he can, because I certainly can't, what his field entails. Before we get to Dr. Novick, who is right here with us, I just wanted to say a few words on Ahmed Durul, who is coming to town, and hopefully I'll miss him. I have a couple of friends at the United Nations, such as Sonny Casella, who does cable television there, and Al Jazeera and so on. But somehow or other I can be persuaded not to visit Ahmadinejad, and I think that a person who wishes Israel would just cease to exist and that he'd like to make sure it doesn't exist is not somebody who should be invited to the United Nations. It's a violation of the UN Charter just to wish for and hope that he can put a nuclear bomb in place to make sure that another nation doesn't exist. But true to the history of the United Nations, they just can't wait to have him there. So I'll pass on this year at the United Nations, and I'll pass on a visit with Ahmadinejad. But there is a demonstration this Monday by our friends at the Conference of Major American Jewish Organizations, and our friend Malcolm Hohenlein, and you can contact them for the details. I believe it's Monday the 24th around lunchtime right in front of the UN Plaza. And now to Dr. Novick. First, his credentials. They're too much for me to explain, so I'll turn you over to Dr. Novick, and he can give you his introduction. Hello, Doctor.
Hi, thank you for having me on the show. I'm a clinical professor of dermatology at Mount Sinai School of Medicine, and I have a particular interest in cosmetic dermatology. And my particular interest within cosmetic dermatology is how you can look younger today than you did 10 years ago. Now, if you think that statement sounds, really far out of line, I want you to listen for the next 20 minutes or so, and I will explain to you how we can absolutely, within the space of maybe 20 minutes to a half hour, turn a face that looks, let's say, 58, like my face, to somebody who looks better at 58 than he did when he was 48, or even younger looking. Okay, so let's start with what you can do. There are a few terms that I'd just like you to remember, and these are relaxing. Relaxing is one of the techniques we use. And by the way, what I'm talking about are non-surgical ways to make a person look better today than they did 10 years ago. That means without any cutting, no scalpels, essentially no downtime, which means no time away from social activities, no time away from professional activities, but ways to make a person look better, and that's men and women. In my practice, about 40 to 45% of the people who come for cosmetic work are men these days. Now, that the national average is about 25% already, but because of the advent of techniques that require no cutting and no surgical and no downtime at all, it's even become attractive, no pun intended, for men to utilize these services and to basically do, what I termed, and actually what I coined the term, the lunchtime beauty fix. Okay, so let's start with, a few terms that I'll explain in a minute.
Let me just interject here. Who said that men never came to dermatologists? In the first place, some of the most vain people on earth are men. Such young men, men with money, men without money, men who are on the prowl, men who are predatory for dates, the young people just out on the field, and married men who are looking for something else. They're all out there. Who said it? The women who monopolize the field? It's one of the stereotypes that is just women. I bet you a good percentage of your practice have always been men.
My practice, yes, a good percentage has. The statistics are that 25% of men nationwide, and that's up from as low as 5%, have recently come into cosmetic dermatologist's office around the country for this kind of lunchtime beauty fix, simply because it can be done over lunchtime. It was a statistical fact. There's no way to contradict what was a simple statistic. Men, for one reason or another, because they were afraid it was too much like cosmetics and that the association with women and effeminate behavior, were reluctant. Certainly in my practice, people who were in theater, in movies, television, these people always frequented, our offices. But now we're talking about people outside of people who are in the limelight, who are coming for these things. But let's really start with what we can do now for everybody.
One more question. Also relevant is that dermatology is more than medicinal. It is essential care for the body, because you could die today from the type of sun we have, from the type of poisons and toxins we have, but it's always been around, and we just don't pay attention to it. And people can, from years ago, from exposure years ago, from the wrong lotions and the wrong things that were made for our beauty or for our care, these things seeping into our body, they have caused poisons now that are cancerous and worse. And so dermatological care is essential for our health, yes?
There's no question about it. There's no question about it. 90% of the aesthetic damage we do to our skin is related to sunlight. 80% of the medical damage in the way of cancers and precancers of the skin is also done by ultraviolet light. So there is no question that both parts of the spectrum of the aesthetic and the medical in dermatology are related to environmental exposure, combined with any kind of tendencies we have on a genetic basis. But let's move on to the magic of looking better in the course of a lunchtime beauty fix, and looking as much as 10 years or more better, and better than you do at the present time than you did 10 years earlier in your life, and what you can do. Okay, the first thing is to relax the area. Everybody knows about the worry lines across the forehead. They know about the crow's feet lines on the side of the eyes when people smile. They know about the smile lines here, the bunny lines across the bridge of the nose. They know about the ripples and dimples on the chin that people get with age, and the parentheses lines that they can get on the sides of the cheeks. So how can we get rid of them? And they know even about turkey necks and the turkey gobbler neck. Now, how do we get rid of those things? And how can you get rid of it very quickly? Well, one way is to relax it with Botox. Botox is a chemical that relaxes the muscles that become overly active as we age. It's paradoxical that with age, when our skin is losing its elasticity and its structural support by losing its elastic fibers and losing its collagen support, at the same time the muscles become slightly overactive. So by muting those muscles a little bit with tiny micro droplets implanted by tiny little pinprick injections through smaller than the tiniest sewing needle that you can imagine, we're able to relax those muscles, so away go worry lines, away go frown lines between the eyes, and we can show you in a picture right now of what it looks like when Botox is injected between the eyes to eliminate the scowl lines. And this
is healthy, this is safe, there's no dangers inherent to Botox?
Botox is an FDA-approved product for cosmetic uses. I have personally been using it for cosmetic reasons since 1991. Its safety and efficacy have been proven in the fact that we now have about 3 million plus people per year in the United States alone who are injected with it. The safety record is probably safer than a plain aspirin. Given the numbers of people who get it every single year, Now, in increasing numbers, and that's just the United States alone, safety is really something. Now, if Shannon would just show the picture of the scowl lines between the eyes, a tiny little pinprick placed between the scowl line muscles between the eyes can eliminate those scowl lines in anywhere from 24 hours to 7 days, and it goes, and you just, person gets the tiny little pinprick of the injection, they can go back to work immediately.
I happen to prefer the person on top.
Well, you may, but the majority of the world does not.
It's more intimidating, it's more emphatic, it's more expressive, it's more emotive. Who's going to notice what the person on bottom means?
And that's precisely why people actually go for these injections, because patients have come to me and they've said, you know, I'm a school teacher. My kids say I look angry all the time, and I'm not. I'm not. So the fact is that what can I do about it? They're only a pinprick away from eliminating this,
so
or they're a pinprick.
From the top to the bottom with 150.
Actually, it takes two or three tiny little pinpricks across the surface in micro droplets, and that is the result you can see 95% of the time. Now, that's just that deals with things like worry lines, the same, those ugly horizontal lines across the forehead, the crow's feet lines that looks like the bottom of the feet, you know, the claws of a crow, the parallel lines on the cheeks here, the smile lines over here.
Who ever thought of all these terrible things? I've gone through every street. I don't look at a person's face. Crows and lines and diagrams and dashes, and who thinks of these things? You wrote this book. You can look younger at any age. Now this is not, so to speak, just mental thinking. This is actual physically looking younger, stopping the aging process, not in terms of your years, but in how it reflects itself on your skin and especially on your face.
And it's been actually clearly shown, Shannon, that if a person looks younger, they actually they live longer and they have a better quality of life. They have more active sexual lives, they have more active social lives, they have more active professional lives. And the point is, this all contributes to a whole attitude. They keep the rest of their bodies, you know, in better shape, because having an attractive and younger-looking face imparts desire to somebody to do the other things that are necessary for good health and for prolonging, life, for increasing longevity. So now let's get.
I'm not saying you should look like a gorilla. Not that there's anything wrong with gorillas out there, but who's to say that we're not buying into the old mystique that you're only you're only as valuable as you look. You're as young as you feel is the old expression that's supposed to work here. And are you not saying that if you're not satisfied with how you look, you should go and get a change for relatively almost no time spent? Is that not the recommendation? It's not saying that regardless of how you feel about how you look, you need this kind of
Oh, no. I'm glad you clarified that. That's an extremely important point, Shannon, and thank you for bringing it up. Because what I'm saying is, if a person feels uncomfortable about certain areas of their face, whether it's their turkey neck or their crow's feet or the smile lines or the lack of texture or the spots on their skin or all the other things that we can address in a lunchtime beauty fix, if they feel uncomfortable about those things, I want to make it clear that we now have the technology to do that without surgery in the course of a lunchtime beauty fix, without downtime so the person can go to work. I'm not saying that every person should have it. No, quite to the contrary. What I'm saying is, if a person looks in the mirror and says, I am dissatisfied with this, it's my responsibility, it's the medical community's responsibility to be able to say, we have a technology to help you with that. But it is not the place of the medical community to say that what you feel comfortable with, if you feel comfortable with, we don't feel comfortable with, we should do something about it. No. This is for somebody. Look, I've never, ever heard of somebody dying by not having cosmetic treatments. I have heard of people dying of embarrassment when they look at themselves and see what stares back at them in the mirror. That's a different story. But if they do feel discomfort about something that they see in the mirror, and they want it taken care of, we now have the technology to do this easily without surgery in the course of 5 or 10 minutes. I put a chin on somebody last night who had, for 67 years of his life, had no chin here and felt awful because it didn't give him. He's a man of enormous, a business, acumen, but he felt it didn't make him feel strong in a business situation. And in 5 minutes, I gave him a chin.
And here we have it.
Now, what we have
In the middle segment.
That's right. Or if a person feels terrible.
There's cheeks, and there's on the bottom we have jaws.
Okay.
And what is a nasolabial?
Nasolabial is a smile line.
That's on top.
Okay.
The nasolabial is on top. There's a smile.
What I'd like you to focus on,
the
please.
teeth in the middle, and the jawline on the bottom.
What I'd like you to focus on, please, is the picture of the jawline. That shows you how we can recontour a jaw. If you look at this jaw, it has the lumps and bumps like an inverted camelback of the jowls. And in 5 minutes, all we have to do is place in a contouring agent. We just lightly numb the area, place it in, and in 5 minutes, the jaw is smooth. No surgery, no cutting. If you look at another picture we have of a nose, here a person go all his life saying, I don't want the surgery, but my nose is hooked, it's bent, it's crooked, it doesn't look. What happens?
I never worked so hard on any show I ever did here.
Well, I want to keep him busy, folks. Listen. So the thing is that if you look at the nose, here was a nose that's hooked, and then in 5 minutes to 10 minutes, the nose is now much straighter. And if we want a tiny tip of Botox, we'll raise the tip. So it depends upon what a person wants. We have the technology to do it.
You're saying that the bump over there was eliminated simply by pulling the skin up.
By inserting a contouring agent in the skin, not touching the bone or the cartilage, we simply shape it so it straightens it, and if we want, we put a tiny tip of a pittance of Botox in this portion of the nose, and up comes the tip so a person can get an upturned and a straight nose, and they've lived all their lives with a bumped, downturned nose. And downturned noses come after deliveries of children. It comes with age, so people can have that taken care of. If they don't like, with age, the fact that the nose droops downward, we can deal with that in the course of a lunchtime beauty fix. Now, the next thing is what we can do with filling agents. And filling agents are just what they say. When you have wrinkles and furrows that are depressions in the face, or even those parallel laugh lines, those parentheses lines around these nasolabial smile lines, fancy word for just the smile line, what we can do is we can simply plump them up with a filler. Or if you have a person who has sunken cheeks. Last night I had a patient who had sunken cheeks on both sides, or sunken temples, but so he had sunken cheeks. And what I simply did was I put in a volumizer, something to give volume. And there were a number of different volumizers. Now, how does the doctor, it's a great question to ask, doctor, how do you know with all the things that you have, what is going to be right for me? Well, it's kind of like a wine list. You know, when you look at a wine list, are you looking for something that is a soft and light wine, like a rosé or a pinochet, or are you looking for something that's bold, that's big, that really makes a hit, and that is something like a Cabernet. Now, we have a wine list of agents now that we can use that are completely non-surgical for dealing with problems. Do we want something bold and brash to stand out? You know, the fact is, when you have deep sunken cheeks, we can fill those in a large kind of way. If you have something that's like very, very fine little lipstick bleeding lines, or these vertical lines that look like smokers' lines on above and below the lips, that we can fill in a different way. If a person has pursed lips, I have a photograph that Shannon is going to work hard defined in the Restylane brochure. It's in the Restylane brochure. It's there.
Are these things lasting? You put these things in, how long does it maintain itself?
Another very, very excellent question. First of all, I just want to make the point that everybody is always frightened. It's a blue brochure with a person's face on the front.
Never mind the brochure. I want my question answered.
Okay.
I never let anybody get away without answering my question.
Okay. The answer is we all, no matter what a person does, whether it's a surgical procedure or the non-surgical procedures I was referring to, nobody gets away without aging. The only alternative to aging is one that we don't even want to discuss. So you will always, any benefits we give you, you will age against those benefits. That's what happens. We all age. But it's not something like Cinderella with the pumpkin, that at 12 midnight, you know, what happens is her coach turns into a pumpkin. It's not, or people ask me, am I going to be worse after I use these things? Absolutely not. What happens is you have a gradual aging process, that the normal gradual aging process you have will go on continuously, and if you need a touch-up, we can give you a touch-up to reverse it. Now, some of these agents last 6 months, some last 12, some last 2 to 5 years, some are permanent, and we have to choose the agent with the individual. And it's something that in my office, I have a practice on the Upper East Side.
I'm not interested in where here's the brochure.
Okay. Now, I presume that he's showing you the person with the pursed lips, and then afterwards that person has more full lips. Pursed lips come with age. Lips thin out with age. Now, a younger person's lips are really fuller and outturned at the bottom, and they're fuller at the top, but not quite as everted. And we're able to take pursed lips and give them back that youthful fullness. And that subtle change in the lips also changes the entire face. Now, if people have bags under their eyes, we now can instill...
Where are the eyes here? I don't have a brochure.
Eyes you don't have. You can put down that brochure now.
Thank you.
The fact is, but we can actually take care of... I treated my eyes 2 weeks ago in advance of this broadcast. I was beginning to develop, I'm 58 years of age, I was beginning to develop, to redevelop bags under my eyes. I simply put in another agent called Juvederm into this area of my eyes, and if you look in the camera, you notice basically I have no crinkles and no dark circles under my eyes. And that was 2 weeks ago. And I did this to myself in my own office here in Manhattan. So, he doesn't care where my practice is, but that's where I did it. And the point is, it can be done for everybody. How long did that take me to do for myself? And you have to say, oh my God, he did it to himself.
Did you work on yourself?
I certainly did, and that's what I'm saying.
Why did you give me the pleasure? I would have loved to have done that to you.
Well, the thing is that, and so you can imagine, if I did it to myself, how much easier it is to do to a patient, and around the eyes, and that, so bags and circles and crow's feet lines. Now, anything that one does to the eye unit, has a disproportionate cosmetic effect on a person's appearance. What do I mean by that? Let's assume I worked only, let's assume a person had bags under his eyes and crow's feet and crinkles under the eyes. Okay. Now, why...
You make it sound terrible, but isn't that the ordinary look?
It's ordinary if you want to look old. It's ordinary if you want to look without vigor. It's ordinary if you want to look tired all the time. So
what does this look?
I can't tell you what it is. I have to turn away from the camera.
It's your brochure here. I'm playing a game here. Let's see if you can tell from your brochure without my showing you the brochure. What does this look here?
Well, if you just turn the brochure to me. Okay, now this that he was showing you is to show you what we can do to resurface the skin. I would really like you to hold this up. Another thing we can do in the course of a lunchtime beauty fix is the mottled discolorations that people have on their cheeks or their foreheads, the broken blood vessels that they can have, the roughness of texture, all of which can be treated also with simple techniques like...
This is how it becomes better.
It
this
becomes.
is how it was.
That's how it
and
was.
This is how it becomes better.
Precisely.
And this is how it was, and this is how it becomes better.
Exactly, and that can also be done in no downtime procedures in just a few minutes in the office.
Now, I didn't mean to interrupt you. You were saying there was some disproportionate connection about
Yes.
eyes.
Okay. In Western society, unlike in the Far East and Japan, where people actually, greet each other by bowing their heads, we relate to each other through our eyes. The same way that I'm relating to you, the audience,
Maybe you
through
do,
the camera.
but some people don't look directly in the eye.
But the majority of people, statistically, the majority of people do relate eye to eye. And so whatever one does to improve the eye unit will make a disproportionate improvement. Anything that one does to improve the area around the eyes will make them look disproportionately better, because people react to their eyes. The same degree of improvements around the mouth will not impact as much. It does, because that's the second most important unit of the human face in Western society. But if you make a change in the eye unit, get rid of the crow's feet, or get rid of the sagging lids, or get rid of the bags or the dark circles under the eyes, with the simple techniques that I'm talking about right now, you can actually in other words, if you want to limit your budget or limit your time, concentrate on the eye unit.
Why do people wear sunglasses? Many people look better with sunglasses. Now, what about people who have problems with eyes as a result of having bags from allergies?
Well, if the bags relate to allergies, the allergy problems should be addressed, okay? And we're not talking about things that can be medical conditions that contribute to bags under the eyes. There are numerous medical conditions that can do that. Those things, of course, and that's part of the initial consultation and the initial visit with anybody, should be to ascertain what we're seeing, the cosmetic deficits, are not related to some medical condition. I'm referring only to people who are otherwise medically completely healthy and are having these changes as a result of largely photo damage through the years. The majority of the aesthetic damage that the person does to his or her skin is done by the age of 18, believe it or not, from sunlight. And that accounts for 90% of the damage. All the other things we say, from gravity and sleep and sleep lines and stress and all these other things, only amount to about 10%, and chronological aging, only amount to 10% of the aesthetic damage that we see in the skin. 90% is sun damage, largely done before the age of 18.
We have about 20 seconds left. You also did the book Saving Face, and then you weren't satisfied with that. People still had to learn more, and you did Super Skin. So there's Super Skin by Dr. Novick, and there's Saving Face by Dr. Novick, and there's You Can Look Younger at Any Age by Dr. Novick. And with all of this, I would recommend you anywhere. And of course, we present this as an educational opportunity. Thank you very much for coming on. We definitely need another show, and have a good week.
All of you that sent those interviews in and helped us capture the mood of what happened during World War II. So without further ado, New York War Stories.